The research indicates that consuming one small can, or 8 fluid ounces, of sugary drinks daily can increase the risk of bowel cancer. This includes all kinds of carbonated drinks, from soda pop to sports beverages. Several mechanisms may link sugary drinks to an increased risk of bowel cancer. Increased sugar levels. High consumption of sugary drinks raises levels of glucose and fructose in the colon and blood. Tumors can absorb these sugars through different routes, promoting their growth. Fatty acid production. Fructose can undergo chemical changes that lead to the production of fatty acids, which contribute to tumor growth. Visceral fat. Excess sugar intake can increase visceral fat around vital organs, which is associated with higher cancer risk. Blood sugar levels. High sugar intake can lead to elevated blood sugar levels, which may promote cancer development. Inflammation. Sugary drinks can increase inflammatory markers in the body, which are linked to cancer risk. These mechanisms highlight the potential health risks associated with regular consumption of sugary beverages.